Okay, good evening and welcome back to another episode of HealthWise. I am your host, Dr. Monique Lescott with the St. Kitts Nevis Medical and Dental Association. We have a very interesting show planned for you guys this evening. Our topic for the show is quality and compliance in healthcare. Very underrated topic. And with me I have the lovely Miss Tamara Liddie, and I will let her introduce herself.
Well, as you said, my name is Tamara Liddie, and I'm the Quality Assurance Officer at JNF, actually for the entire institution-based health services.
Wow, okay, so we should have corrected and put that you're the head of the quality assurance for the entire Ministry of Education. That's quite a lot of work. How do you manage?
Well, because I'm just starting is not as overwhelming because there's a lot of things to do where I'm at right now at JNF. But the longer I'm there, the more I see that needs to be done. And so I'm branching off slowly but surely.
Gotcha.
Yes.
That's interesting. When it comes to quality and compliance in the healthcare system, I don't think I've ever heard much persons really touch on the topic. But as a health-based institution that's government-run, it's very much a cornerstone of the institution, and I don't think the public really knows a lot of what goes on in terms of running a public health facility the size of JNF. I mean, it's small, but it's still big.
Definitely. That's a good way to put it.
Yes, JNF is it's an intimate setting, but still not as easy to, I would say, bring under a lot of control as we might like.
Absolutely, because there's so many moving parts, there's so many components that make up the institution, even at JNF itself. And the compliance and quality assurance aspect of it is so large, right? It's so many moving parts, and as you may know, healthcare is forever changing. Evidence-based practices are updating and changing so frequently, so we have to stay up to date with all of these policies and procedures and practices and so on, just so that we can stay relevant.
That is a really, really good point to make.
Absolutely.
For sure, like I think a topic like this is very pertinent because, like I said, I don't think the general public really knows how much it takes to really bring an institution and even all the other health-based institutions that are of a public sector base here, as you say, many, many moving parts that are supposed to be in sync, but sometimes we don't necessarily always achieve the harmony.
No, but that's why they hire folks like me in my position.
Yes.
And the goal is to get it there, to get us to that point where we are compliant, we are following rules and regulations so that we can meet the requirements set by the different regulatory boards.
Awesome.
Right?
Awesome. So we're going to get right into it. So can we have the first slide and we can discuss what exactly is compliance in healthcare? I'll let you take the floor.
So to make it very simple, I look at compliance as doing what is required.
Sorry, can we have slide number 2? Yeah, thank you. Go ahead.
So I'm not really reading from the
That's
slide,
fine.
but just so I can flow. Compliance is really about doing what is required. Some of the things that it may focus on would include like the legal and regulatory aspects of things. We definitely have to meet the minimum standards, of course, and also in order for us to avoid penalties and fines, we have to be compliant. So those are like the main aspects of it, of compliance.
Gotcha. So now we have covered the compliance aspect of it, so then we go to the quality.
Now the difference with compliance and quality is actually about doing what's best, right? And so the main focus here is how do we improve continuously, right? How do we exceed our minimum standards, and how do we achieve patient outcomes and satisfaction? So the compliance is about meeting the minimum requirements, and the quality is about surpassing that, doing the best practices.
So when we do you guys have to work hand in hand basically with maybe any statistical departments, or if you get feedback, is it something that you relay directly back to the institution in order for, affirmative actions to be taken? How?
To an extent, yes, but that is not quite my role there at the institution-based health services. My role is just with the 4 facilities within the institution. A lot of the statistics that they're gathering is for like the public health sector. Granted, I do collect certain statistics as well for the institutions because we need those. We need to know in terms of like fall risks, incident reporting, like there are certain statistics that we need to collect.
Definitely.
But it's not like, how should I say this, like encompassing of everything in healthcare.
Understood.
Yes.
So in terms of to ensure the quality of it, then I guess you would have to be the one to do all the team building and all of the coaching?
I wouldn't say all of it, but definitely a large part of it, because one of the things about quality assurance is building that culture of leadership, that culture of compliance. And it's not as easy as it sounds.
Of course not.
Right? But it really involves retraining our minds on how to look at things through different lenses, how to change the way we've always done things just because that's the way we've always done it.
And that is a very
Right.
Kittian response to things.
Actually, it's everywhere.
Really?
It's everywhere, but here you just get it raw with the dialect. That's the difference.
True.
But if we can change people's mindsets from what we're accustomed to doing to best practices and evidence-based practices and how it
Exactly.
should be done, because healthcare is forever changing, then we stand a good chance of, adhering to these quality practices and also forming that culture, that quality culture.
I agree, especially with the evidence-based practices. I think that's a very, a very strong foundational aspect of it is to use evidence-based material in order to build from. I think that makes it very much a sound structure to start with.
Absolutely, because there's scientific knowledge there, there's scientific facts and proof. It's evidence-based because it's been tested, it's been tried, and the products of it is true. And so when we use these evidence-based practices, we know that we're using the latest information. Yes, to adhere to.
Definitely. We're going to continue our discussion. We're going to break for a few short moments so that we can pay some bills. I know you guys can't wait. I know you guys can't wait until we come back. Just a few minutes.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese, and 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
And thank you and welcome back for those of you who are joining us for the first time, and welcome for our persons who have not been here before. Our topic for this evening is quality and compliance in health care, and I have with me my lovely guest, Miss Tamara Liddie, Head of Quality Assurance at JNF and all of the other health institutions in St. Kitts. Thank you guys for joining us again. So we're going to continue our discussion. I was asking about there's a clause in the quality care in healthcare about healthcare ensures the individuals receive patient-centered care and effective treatment. Now that's a huge part of.
It is a very huge part of what we do, not just my role, but the entire facility on a whole. Everything we do is for our patients, and that's really how it should be, because essentially we're talking about a life.
That's true.
Right? So that means if they have grievances, making sure they have a way to file those through patient satisfaction surveys, or they can approach either myself or someone in administration, making sure that they're receiving the care that they think they're going to receive, making sure that whatever procedures that or care that they're coming to us to receive, that it is explained to them, because while us as the professionals may think that this is what's best for you, the patient themselves might not feel that way, and so it's all about education, making sure that they understand what it is that our findings reveal,
and to also respect their autonomy as well.
Yes,
I found even when I just came back from overseas, so I find sometimes some persons, I guess, they took away a lot of the autonomy from the patients.
It should never be that, because also, I am a nurse as well, and one of the things in nursing, we have 10 rights, 10 patient rights, and one of those rights is that the patient has the right to refuse.
Exactly.
So even if it's a life-treating
saving procedure.
Right, a life right, so they have the right to refuse that.
So then we really need to be more conscious and considerate of persons' religious backgrounds.
That as well.
Because I know
the whole
of
patient.
Exactly, because then I've had situations where persons, because of their religious background, they don't accept blood, and
right, like
us,
the Seventh-day Adventists.
Yes, and we're supposed to respect that and not make them feel uncomfortable or foolish for making such a decision.
Not at all. I mean, and there's also documentation that we as an institution needs to have in place to respect their autonomy
and to take it serious, like that's
Absolutely.
supposed to be part of the admission process.
Yes.
That's probably supposed to be highlighted in red or something.
There's actually consent forms for that.
Yeah.
And so those is a part of my job, is making sure that we do have those consents in place, so that if they want to receive blood, they can get it. If they choose to refuse it, there's also a consent form for that. We're respecting their decision.
And we shouldn't make them feel funny for it. That's my only thing.
Not at all.
I agree. Okay, so our role here is to provide and deliver humanized care by following evidence-based practices, promoting communication, collaboration amongst the healthcare professionals, and prioritizing individual preferences, basically.
Absolutely.
Okay, so I guess we can move on to the next slide. We have compliance. I guess these are how many? The 7 pillars of compliance?
No, actually not those ones.
Not those ones. Okay, so I'll have you can go through the pillars.
Well, we call them like the domains of quality in healthcare. So there really are 7 of them. The main component of it is 6, but we always add a 7th. So the first one would be safety. So we always want to make sure that we're avoiding causing any type of harm to our patients. Right?
Just a second. That's the wrong side. I think we're looking at slide number 5. Go ahead.
So the very first one is the safety component. Like I said, we want to avoid harm to all of our patients. We also have effectiveness. So every care or any care that we provide to our patients, they have to be based on best practices and scientific knowledge.
Awesome.
Right? So we have to give them the best. It's not just what we want to do.
But I think the public thinks that we're just doing what we want to do, and I really think it's really important to put it out there that this is evidence-based.
So what I've noticed is something similar but slightly different. I've noticed that the public wants to receive care that they tell us that they want.
Yes.
Right? And it's not so much what is scientific, what is evidence-based. So when they come up there and they say, no, well, you didn't give me any drips for this. Well, what you presented with doesn't warrant you to get drips because it may cause adverse effects to you.
Exactly.
Right? Or what happened to your cousin may not be exactly what you need. Right? So those are the things that we see, some of them. There's also the timeliness component of it. So we absolutely want to reduce wait times and reduce the potential of causing any harmful delays in patients receiving care. Now, in any emergency setting that you go to, whether it's here or internationally, you'll notice that there's wait times in our ER.
Definitely.
And so us complaining that the wait times are really long, you'll find that everywhere.
Yep.
We have a triage system for a reason, and it's not first come, first serve.
Nope.
It's severity of the issues that you're presenting with, right? There's also the patient-centeredness, and so we have to provide care that is respectful of and also responsive to that individual and their preferences. So that goes in line with their autonomy and their right to refuse and things like that, or to receive treatment. There's an equity component. So we have to provide care that does not vary in quality because of personal
any prejudice, meaning
exactly,
and biases,
sex, gender. Well, I know the president, so I should receive this type of care. No, we have to treat everyone the same all across the board. That is how it should be.
I've had one member of the public eloquently ask me to please bring up for the LGBTQ plus, because this is Pride Month.
Oh.
Yes. The LGBTQ plus, they also would like to appeal to be treated with equity as well, because sometimes they've expressed to me that they can feel a bit of discomfort sometimes and a bit of distance between when they have to, I guess, have to see certain medical professionals. Some of them have expressed to me they've felt a bit of discomfort and were not able to open up as much as they probably needed to, which I think is sad. But that's a huge part of it, is to not include your personal bias when you're trying to treat a patient. You're not supposed to, it's not supposed to really matter what their preference is.
That exposes one of the gaps in our system and how we have room for improvement, right? We're not a perfect system. The sixth domain in healthcare is efficiency, and it really is about avoiding wasting everything, whether it's equipment, wasting supplies, wasting ideas, wasting energy.
Wasting ideas?
Yes. Can you imagine your subordinate or someone, one of your coworkers, even though they're a lower station below, you come up with this great idea and you're pushing it down because they're at a lower station?
But that happens all the time.
It may, but it shouldn't. We should be, it's about being equitable all across the board.
I agree.
And then the final one is accessibility. So we want to ensure that all of our patients have access to the care that they need without barriers at all, right? Yeah, so it doesn't matter if you live here, you live around the country, you live in poverty, or you're rich. It really doesn't matter.
And we can also use that opportunity, I suppose, to engage the family of the patients when it comes to the quality of the care, because it's one thing for us to give them the quality care, but then I think the family now has to help and give a lending hand with the support care after the patient may have leave our presence.
Right, and this is where we as healthcare providers need to continue doing a good job. So I don't want to say that we don't do it, because we do, but we always need to include the next of kin or the family members so that they are educated on what the patient's needs are once they leave our facilities.
But sometimes I feel like the next of kin role, I don't think people understand how serious the next of kin is. Like, I feel like in the wake of an emergency, we take in the information, because I've triaged before, and I take the information, I would take the time of the incident, I would take the medication, and then the next of kin. And it's given to me very flippantly, and then when I have to call upon that same person, what you're calling me for, I'm like, because your name is on the form?
So we get a lot of those incidences where they just give you a name randomly. Matter of fact, sometimes they use the healthcare workers as next of kin, and then when they don't pay their bill, of course, the facility's calling the hospital staff.
I've never heard of that one.
You know, Jane Doe said that your next of kin, they owe $1,000. So
I don't think people understand what a next of kin is, to be honest with you. So can we like elaborate here on what a next of kin is?
It needs to be someone who is aware of your medical situation, someone you're giving authority for us to communicate what's going on
And
with you
to possibly
too.
speak on your behalf if need be?
Yes, absolutely, because if something happens to you and you're not in a position, you're not cognizant enough to tell us what your needs are or to receive treatment, then we need to call someone who can make those decisions for you
And who
without
has
violating
access to
your
your
rights.
documents and whatever as
Even
well.
better if they do. Absolutely.
That's awesome, but I just thought that was a very interesting phenomenon that, you know, this, like, I've had persons ask me, like, so why are you calling me? I was like, because your name, you put your name down? Okay, so we'll continue. Where we already finished speaking about all 7 of them?
We did.
Okay, so I guess I can continue. So I have here with me, I guess I can let you read off of mine, the consequences of non-compliance. I will let you go through that one.
Okay, so one of the consequences of non-compliance is reputable damage. We can definitely lose trust in and confidence in the organization's ability to provide care for us. There's loss of revenue, and that is actually a significant one because it can impact the organization's financial stability, limit their investments, especially in any necessary medical equipment and services that we may need to provide services. There's also loss in productivity. So fewer individuals can be supported. It's affecting the organization's ability to treat the same number of individuals effectively. And so that's a major compliance, consequence of non-compliance. So this is why we need to adhere to those regulatory standards.
So we have like a statutory body here who sees about the regulatory standards of the institution?
In terms of?
Of like the kind of quality. For instance, if it's a legal issue, if it's a lack of resources issue, lack of stock issue, do we have an independent body who regulates or helps us to regulate, or that's purely internal?
Not that I'm aware of. It is their internal. I know with our central medical stores, there are things that
so
they have
they're the
to
ones
adhere to. But as of December of last year, we just formed the St. Kitts and Nevis Medicines and Therapeutics Committee. It's a national committee, and it should also govern some
We formed it last year?
Yes. Yes, so they invited me as one of their members. It's, I think the CMO is the chair. Yes.
Wow, I had no idea about this.
It's in the development phase.
So can you tell us a bit more about that, or?
Well, it's still very new, and we're trying to design it and create it, if you will, like what it's intended to do and how it should really govern our practices in healthcare.
I think I like it. I really like it.
I love it.
So this was on the news?
I don't think it was.
You guys are just very quiet and just trying to keep all of the information to yourself. I see you.
No, we're trying to do things the right way, and we'll present it to you
when the time is right.
Yes.
Okay, I'll hold you.
Yes.
I'll remember that one. So we're going to take a few minutes for a short commercial break so we can pay some bills. We'll be right back.
It's time that we realize that we must work together to thrive.
The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see, and the climate's changing.
But hope is remaining.
That we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean.
And welcome back, everyone. For those of you who are just joining us, welcome. And for everyone else, of course, I already said welcome back. So this evening I have with me Miss Tamara Liddie, Head of Quality Assurance and possibly the entire Kittian Medical. I'm just messing with you. So she's Head of Quality Assurance in JNF and most of the public health systems. So we're going to continue our discussion, and the part that we're at is the how to avoid the non-compliance, which
We can touch on that.
oh sorry
So here we have 3 ways to avoid non-compliance: is to contextualize your resources, to educate your team, and also to know what you're up against. So once you have those, you can definitely avoid.
and I can vouch that she does educate the team. I think it was very lovely of her to even come tonight because I knew she had presentations all day.
Did.
So I'm very grateful for her to have come here. I know she's already tired. So we're going to move on. Go ahead.
All right, so something I wanted to touch on is how we ensure quality and compliance. One of the ways that we can do that is to establish clear policies and procedures. When I first started at JNF, I noticed that a lot of the policies were outdated, and so of course everything is about evidence-based practices, and so it was about revising those policies, updating them to match what's current regionally and internationally, and submit them before
That's a lot of
EMC.
research.
It is,
That's
but
a lot of research.
it is, but keep in mind that we've been practicing using a lot of the evidence-based practices, which our policies just didn't support what we were doing. And so we had to update
So it was a
them to
disconnect,
match.
right?
Exactly. So we need to make sure that our policies, which are our go-tos to support us in our decision-making, match what's current, what our current practices.
That probably took weeks and months.
It does. I mean, but it's exciting to me, though.
So do you think that we're going to ever get to a point where we have a handbook, like a staff handbook of golden
we have those
rules?
already. We have all of those already, but again, it's a matter of keeping them current.
No, updated ones, of course.
They're in the process of updating the handbook, like the employee handbook and such, but a lot of the handbooks, especially the ones on the units, they've already been updated within the last year or so. Yeah, so it's just a matter of us knowing that they're there and educating based on what's there, because that is what's most current.
I'm definitely going to get me an employee handbook so that I can say on chapter 4, section, whatever this.
Right.
Just playing. Okay.
One of the other ways that we can ensure quality and compliance is also to have regular staff trainings. And so one of my roles there is to make sure that the staff is up to date and educated on all of these evidence-based practices, how the way that things should be done, what's expected of them, because again, our clients, our patients are number one. That's it. That's a life, and we don't take that for granted, right? And also to monitor and to audit our performance. So the only way that we know that we're meeting standards or we are compliant is to perform audits and to continuously monitor our practices. So that's one of my roles.
So who
there.
does the audits? You?
The units should be doing a lot of the auditing, but one of my major roles is auditing every department there at
How
the
often?
facility. Some audits are done on a weekly basis, some on a monthly basis. Certain things are done daily. And it's not a one-man job. That's why we need to work as a team and build that culture of leadership.
Hi,
that
why
spoke
was
of
I thinking you
earlier.
were going to tell me every quarter?
If we did it quarterly, then we'll never have sufficient data or accurate data, because things will slip through the crack and we need to be able to catch them as they happen, right?
But that's a lot of work.
Right. So also, we need to, like I said earlier, foster that culture of accountability. A lot of the time is, well, this is how we're used to doing it, so this is what we're doing. No. So with the right training, we can foster a culture of accountability so we can ensure that quality and compliance remains intact. And then also, like I said before, just using evidence-based practices, because we can never go wrong with that. It's scientific knowledge.
True. I agree. I strongly agree. I support that. Okay, so those are the three points
The
of it? The 5 points. So for what I I did my own little research, and there was strategies for balancing the compliance and quality aspect of it. So one major one they were saying is appointing a compliance officer, which is you, and the dedicated team. My question is though, how big or how small is the team at JNF that you, how is it like a set figure, or is it that people, we just work as a team where we can, how's it?
So right now, it's just me in the quality department. It's not really a department, it's just me. But I work collaboratively with the other
all the departments, I would imagine.
I have to.
Of course.
So working with infection control, all of the nurse managers, the head of the departments, with administration, the EMC committee come right down. I have to work with everyone and keep the communication between all of us so that I can do my job effectively.
I agree.
Yes.
I actually felt the need to highlight all of this because I always have to defend the place where I work. I work at JNF, and I just feel the need to just shine a light that I'm trying to convey to everyone, that we do have systems and policies in place so that certain things don't fall through the cracks, so that we are able to keep up to breast, so that we are providing quality care across the board in a non-biased manner, as we should. Because I mean, sometimes when I listen to the media, I can get very depressed about the stuff that I hear.
You don't know how hard it is to restrain myself when I see the post on social media, because it's like what you're posting is from your perspective, from a non-clinical standpoint.
Of course.
And so you don't really have the factual knowledge or information about what you're putting out there.
Exactly. So then that's why I felt the need. It's not like I'm trying to do any tit for tat, of course, with the public, but of course I needed to really shine the light on just how deep it is and how far we go to ensure the organization is organized.
Absolutely.
It's organized. It might be organized chaos at times,
but it's still organization.
It's organized, and we can't help that there's a bit of chaos. Sometimes things just happen.
Yes.
It's the nature of the
You'll find
beast.
that everywhere that you go, we're not portraying ourselves to be this perfect institution, but the thing is that we are doing what we need to do the way that it should be done, and that's what's most important.
Exactly. And so my role here is to just allow the public to see that there is a recourse. There are people you can speak to. There are persons who are in charge of grievances if you have a bad experience with any of the staff or any of the healthcare providers at JNF. There are protocols and procedures in place and people you can speak to.
And they can definitely come to me too.
Especially now that
I'm pretty easy to talk to.
Especially now that I've put you on the TV.
Oh my God. Yeah, so they can definitely come to me, and then,
I got you.
I'll address their concerns.
And I know you would. You're very easy to talk to, I must say.
Oh, thank you.
So I'm going to introduce my personality spotlight. Her name is Nelisha Seaton, and she is going to be our spotlight for this evening.
Our medical personality is Nelisha Seaton. Nelisha Seaton is described as a proud and dedicated employee of the Joseph N. France General Hospital, where she's worked for the past several years. She's currently stationed at the hemodialysis unit. She says as she carries out her daily tasks, she is working diligently to evolve in the field of business administration. She says every day in her department is an opportunity to learn new things and grow, and for that, she is truly grateful. Our medical personality is Nelisha Seaton.
Yeah, man. Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
And thank you and welcome back, viewers, for those of you who have been with us. And if you're joining us for the first time, welcome. Hi, I have with me this evening Ms. Tamara Liddie, Head of Quality Assurance, JNF, and our topic for this evening is quality and compliance in the healthcare system. Before we conclude and wrap up our program, though, we have our healthcare bulletin that I would love you guys to indulge in for a few minutes before we conclude.
Hi, good day. I'm Siobhan Richards, the PRO for the Ministry of Health, and it is my pleasure to introduce you today to Mr. Errol Holder, and he's our urologist here at the JNF Hospital and in the Federation on a whole.
Good afternoon. I am the Dr. Errol Holder. I am urologist. I'm here in St. Kitts since May 2022. Yes, May 2022.
Okay, so Mr. Holder, could you let us know what exactly is a urologist? What do you do? What type of doctor are you?
Okay, so the urologist, is a doctor that studied the urinary system disease.
Oh.
And the affection on the male genital. I can see here in St. Kitts that the patient coming frequently to my clinic for the prostate problem. Okay, it's the more important problem here in St. Kitts, the prostate problem. Okay, so the patient coming with urine difficult, especially the men after the 45 year. Okay, difficult in the urine. Sometimes they can't pee. Good. Sometimes coming with affection in the kidney with kidney stone. Here in St. Kitts is very frequently the kidney stone. They coming with a back pain, blood in urine. Sometimes coming with affection on genital, for example, the phimosis in the kid, in the boy. Phimosis, hydrocele is the fluid inside the testicle. Tumor in testicle. Tumor, the prostate cancer is very frequent. The prostate cancer. Any illness in the urinary system is plenty illness.
Okay. So basically, you go to the health center if you feel that you're having any issues. You go to your local health center in your area, or you can go to your private doctor, and if there is a need for Dr. Holder, they will give you a referral, and then you come to outpatient at JNF, and you can see Dr. Holder on Wednesdays at 1 p.m.
1 p.m. Yes, exactly.
Yes. So especially you men, you have somebody here who is specializing in your urinary health and your genitals. Again, Dr. Holder is here to assist you, and his clinic days are Wednesdays at 1 p.m. at the General Hospital, JNF Hospital.
Thank you and welcome back. I'm sure everyone would have gained a lot of insight based on what our PRO just said in the health bulletin. So for all of you males out there who are experiencing any clinical issues with your health, we do have a urologist who is more than happy to assist you, Dr. Holder, a personal friend of mine. He's very good at what he does. So we're going to continue with the topic, but we're also going to wrap it up in a while. We're just going to touch bases and go over what we already discussed, so we can just remind the public quite gently again what is quality and compliance in healthcare.
So briefly again, compliance is basically doing what is required. Quality is doing what is best.
I like that.
Just to break it down, keep it simple.
I like that. Keep it simple. I really like that. So, and in terms of how do we enforce the compliance? I see here we have regulations, standards, policies, laws, requirements, and rules.
Yes.
And I guess we also have the 7 pillars, or you have the what did you call it?
So actually the 7 domains.
The 7 domains,
So
not pillars.
Safety, effectiveness, timeliness, patient-centeredness, equity, efficiency, and accessibility.
And we're also in the process. What was the name of that committee that you said that started last year that I knew nothing about?
The St. Kitts and Nevis Medicines and Therapeutics Committee.
The St. Kitts and Nevis Medicines and Therapeutics Committee. I'm going to be looking out for you guys in the future. I'm looking forward to see. I'm looking forward to see all of the creative work that you guys gonna push out there in order for us to be able to, I guess, use your knowledge.
Absolutely.
I'm looking forward, so I will definitely be keeping an eye out there for any work or any periodicals that you guys plan to do any publishings?
I'm not sure yet.
That's not a bad idea if
It
you,
may not be.
especially because you have access to the statistics and what's not. Having an article, a periodical, especially for medical academia, which is lacking. We don't have a local database for persons who might be looking for medical academia. Actually, it's very difficult when you're doing research topics and you want locally based articles. You have to go more regional than local with certain things. So I'm hoping that in time we can have a more wider database for academia that we can use for research, right?
I can probably bring it up. Like I said, I am a committee member, so.
Thank you. I like it. Okay, so that will bring us to the end of our show. I hope you guys was able to learn as much as I did. I had fun covering the topic. I really enjoyed having Miss Tamara Liddie as my guest. She was very informative, and I would like to personally thank you for stopping by.
Thank you for having me.
Awesome. So that would be the end of our show. Thank you for watching, and good night.